Welcome to Palmetto Perspectives. Tonight, an important discussion on the opioid pandemic. I'm Felicia Edie. South Carolina and the entire country are seeing a rise in opioid misuse and overdoses. It's happening at epidemic levels. And since the start of the COVID-19 pandemic, those numbers have continued to increase. The problem is proving to be a public health issue as well, putting a strain on those addicted, but also a strain on their families, law enforcement, healthcare providers, and first responders. Tonight, we take a look at what's currently in place here in South Carolina to help those addicted and future programs and initiatives, and how we all have a role to play in the fight against opioid abuse. And as always, we definitely want to hear from you, our listeners and our viewers. You can join tonight's conversation by commenting on our Facebook page at South Carolina ETV. Desiree Cheeks is here with us tonight. She will be taking your comments on air for our panelists to answer. So again, on Facebook, that's South Carolina ETV. Also here in studio are 4 individuals representing state agencies and county agencies and organizations that have been working in tandem for several years now to combat this crisis. And they are Sara Goldsby. She is the director of the Department of Alcohol and Other Drug Abuse Services, also known as DAODAS. Also joining us tonight is Dr. Edward Simmer. He is director of DHEC, South Carolina Health and Environmental Control. Naida Rutherford, she is coroner for Richland County. And Kratz is program administrator for opioid treatment services at the Charleston Center. Thank you all so very much for joining us. This is such an important conversation that we're having. But I want to start from the very basics, from the very beginning if we can. When we use the term opioid, what drugs are we talking about? And anyone can answer.
I'll go ahead and start. I know we've got a panel of experts, but really we're talking about prescribed opioids, things that are licit and legal and FDA approved, and things that are illicit, made from either the poppy plant, opium derivative, or other synthetic opioids that we're seeing manufactured now.
And these drugs are prescribed, these are strong drugs, they're prescribed to help manage pain. How do they impact our bodies, especially when they are misused or abused?
So they actually work on the brain. There are opioid receptors in the brain. And when they're used as prescribed, the intent is that they decrease the level of pain, which is what opioid receptors do. Because we make opioids naturally in our brain to help us control pain. And sometimes when we have too much pain, we prescribe opioids to help with that. But when you abuse them or you're addicted to them, what happens is that the normal amount that you would take no longer helps. Your body becomes used to them, your brain becomes used to it, and you need more and more to get the same effect. And then when you stop using, you can go into what's called withdrawal, and that can have a lot of very significant symptoms. Basically, since opioids tend to slow you down and stop pain, when you go through withdrawal, you may have intense pain, a lot more pain. You can have high blood pressure, you can become very nervous and very anxious. So, opioid withdrawal is very, very difficult, very miserable for the person to have to go through, and in severe cases can even cause serious physical harm or even death.
Dr. Simmer, when did the state begin to see alarming numbers or trends when it comes to the misuse of these prescription drugs?
We've had a problem with opioids in the state for a long time, certainly dating back at least 5-10 years, probably more than that. But we've seen an alarming increase just over the past 2 to 3 years. Just to give you an example, we had about 500 deaths from opioid overdose in 2019. In 2015. And by 2019, that number had jumped to over 800. And we fully expect that for last year, the numbers aren't completely done yet, but we expect it'll be over 1,000 deaths. So we've seen a very significant increase, both in the cases of opioid overdose and opioid death.
And this is not unique to South Carolina, as we mentioned in the open. This is happening all over the country. During this time period, when we saw cases starting to rise, we saw leaders and governors across the country start to take action. In 2017, here, Governor McMaster created the South Carolina Opioid Emergency Response Team, which many of you are a part of or very familiar with. Kind of take us back to that time when this team was formed. What did that team look like, and what were the first steps you knew you needed to take to start to help South Carolinians struggling with this problem?
Sure. Well, most importantly, we're really a cross-sector group. We are state and local agency leaders and people in recovery who are all connected to the situation in some way or form, but across sectors meaning public health and public safety. So most importantly, we have our law enforcement working on interdiction, working on the flow of illicit drugs being trafficked in the state, but also our treatment and recovery folks, county leaders, city leaders, who are all hands-on, on the crisis day to day from another perspective, from that public safety perspective, public health perspective. And so really it's about communication, collaboration, and coordination, really sharing information in as close to real time as possible for as targeted of efforts as we can, commit to with the resources that we have in real time. So it's really just about coordinating at all levels the response across sectors.
What are you guys seeing from the vantage points of your professions and even in your personal lives, in your homes? But what are you seeing when it comes to how this pandemic is playing out in South Carolina? We'll start with you, Caitlin.
Well, what we're seeing is I don't think that there's anyone that's not been impacted in some way, shape, or form, whether they're struggling with substance use with opioids themselves, they know a family member, law enforcement, they're responding to overdoses. Schools are now trying to respond because they're finding more illicit substances in the building in younger grades. So what we're really seeing, in my work is, of course, I'm seeing an increase in overdoses and the various types of things that we're seeing as far as opiates or the different analogs of fentanyl. But personally, there are times I go out and you can't not see a billboard or walk into a pharmacy and not somehow have it tied back to the opioid epidemic and its impact on the community.
Naida?
I'm going to read the names of these drugs so that all of the viewers watching understand. They heard the very scientific definition of what these drugs are, but most of the people watching have heard of oxycodone, Oxycontin, Percocet, hydrocodone, Vicodin, Norco, Lortab, morphine, hydromorphone, Dilaudid, fentanyl, codeine. These are medications that have been that have been prescribed to either you or a family member that are probably sitting in your medicine cabinet, and you don't think of them as being something that is harmful to you or your family. You think, oh, I'll save them for the next time that I'm in pain. But what happens is you use them, or someone comes into your home and uses them. Maybe it's your child, maybe it's your teenage son who's just trying something for the first time because of something he saw on TikTok. We don't know, but we don't think about how the things that are in our medicine cabinets, things that shouldn't be used illicitly, are being used that way. And so it affects the families, it affects our communities, because we are seeing deaths almost every single day as the coroner. Since I took office in January, I have to call a family and tell them that their loved one has died because of an overdose. And it transcends race, it transcends gender, it transcends socioeconomic status. It is affecting everyone in our community.
I'm glad you mentioned that. I was going to ask, from the data and the research that you guys have to your disposal, at your disposal, how is this pandemic playing out in South Carolina? Is there a more vulnerable group? Are there geographic hotspots? But is everyone vulnerable?
Everyone is vulnerable, and I will leave it at that. I'll leave it to the experts over here. Certainly they have a lot more data than we do, but I know that every single day I am calling at least one family to tell them. I had one day where I called 10 families to tell them that their loved ones had died from fentanyl overdose. That was a sad day.
Dr. Simmer and Sara, from your vantage points, how do you see this pandemic impacting people throughout South Carolina? How is it playing out from where you're standing?
So our opioid emergency response team has an overdose response team. We're looking every day, every week across DHEC, DAODAS, SLED, and our federal partners at the incidence of suspected overdose across the state. So we can see in real time, like you said, the geographic impact. There are some counties being impacted more, and we really monitor that to see if there's a spike in a certain county. We're doing direct outreach across law enforcement, treatment, county officials, hospitals, to do as targeted intervention as possible. We really see the Grand Strand being hit really hard. And then, of course, as you can imagine, with the more populated areas, Richland County, Charleston, and Greenville, they have been impacted more because of the higher population. That being said, we do see some rural counties, Greenwood and more recently Fairfield and our Chester, Union, Lawrence area have been impacted more. And that is a direct result of the illicit supply chain coming into those areas and the very, very potent fentanyl analogs that are actually look-alike prescription pills. They are completely illicit, but they are manufactured and made to look like something that is an FDA prescribed drug. And so if you don't have a careful eye, these things are very deceiving, which makes them especially dangerous.
Okay. What are some of the ways that family members what are some things family members should keep a close eye out for? Because this sounds like it's a fine line, or it could be a fine line, but if you're a family member or a loved one or a pastor, anyone, what are some symptoms or some red flags you should look out for?
Well, certainly if the person's been prescribed opioids, if they're starting to take more, if they're continuing to take them longer than the doctor recommended, so that's certainly one red flag. But you can also look for fatigue, a person who is maybe neglecting work and social obligations that they used to do, a person who seems to need more money, and because obviously if you're not getting them from a prescription, you're going to have to buy them somewhere. So if they're starting to need more money for some reason, they're starting to ask for money, those are all signs that this person is in some way, probably hooked on some substance, whether that's opioids or something else, but those are certainly warning signs that I would look for as a family member, that I've got a family member in problem.
Okay. We're going to turn now to Desiree because someone viewing online has a question or a comment about tonight's conversation.
Yes, our first viewer question: from pharmaceutical companies to doctors overprescribing to state and national healthcare regulation agencies, there seems to be plenty of blame to go around for the opioid crisis. How do we as a society move past the blame game and establish a realistic pathway out of this crisis?
I think that's a great question. I think one of the ways that we have to do that is remember that addiction is an illness. First and foremost, addiction is an illness, rather like diabetes, high blood pressure, and we need to treat it like an illness, which means the number one way we get through this is to make sure people have access to great treatment, that we reduce the stigma of seeking that treatment, and that we make that help available very quickly. There's a number of good treatment options across the state. If people think they need help, if they call 1-844-SC-HOPES, H-O-P-E-S, that's a great way to get some answers and get some help. But I think that's the number one thing we need to do is get people help for these problems. We also need to work with both the public and providers on educating about the risks of opiates, about appropriate prescribing and not prescribing too much, about things like this program here, I think is very important. And then I think the third thing we need to do, is realize that the opioid problem is not going to go away. It's with us, but we need to make sure that we have the resources available so that when people do overdose, things like naloxone, which can reverse an overdose very quickly. The more people that have naloxone have been trained to use it, we offer it to the public, we can train the public to use it. We've given it to more than 11,000 first responders in South Carolina. So when we do that, we can help avoid some of the deaths from overdose and then get them into treatment.
Do we have another?
We do. We have another question, and this one is more along the lines of someone who is trying to responsibly manage their prescriptions. Since the opioid epidemic started, severe reactionary actions and new policies have significantly affected those of us with chronic pain and our ability to get adequate pain med coverage. I'm on 1/3 of what I was 4 years ago, and it's miserable. Many of us have taken our meds responsibly, never lost a script, etc. I used to be more active and have a better quality of life when my pain was controlled. What is the solution for those of us that actually need these pain meds?
Caitlin, what do you see at your treatment center for someone who may fall in a category similar to this? How do you guys help that person manage their pain and therefore live a thriving life?
Absolutely. Well, at Charleston Center, we primarily treat substance use disorder. We don't do pain management, but we work with a lot of our great local partners because we do know that pain is real and that people need to effectively manage pain. And when taken appropriately, opioids can do just that. And so I think it's, as Director Goldsby, this is all about partnership. And so where we see an increase in substance misuse with opioids, we also need to look at the other side, the health side, the pain management side, and how have they been impacted by this epidemic. And so, what we do is I sit on a lot of meetings with local pain clinics to kind of stay on top of what are they seeing, what are they prescribing, what are their best practices, so I can be, an educator and pass that information along. Or for folks like that have unfortunately had their medications changed because of the epidemic, providing them maybe some guidance or other resources to advocate for themselves and whatnot.
What are some of the factors, what are the leading factors that lead people to use or overuse or even abuse? What have you guys seen and what are you hearing from members of the community and in your partners that you're working with?
Yeah. I mean, I always say people either use or misuse any substance. You drink alcohol or use a drug to do one of two things, to either feel good or to not feel bad. And so, initiating use is often a coping mechanism and a strategy to alleviate another kind of pain, whether it's physical or psychological. And I think that's what we've seen an increase of over the pandemic because of the social and environmental circumstances with COVID-19, a lot of uncertainty, anxiety, depression. Related to the circumstances, people have sought substances or perhaps begun drinking more or tipped over into a substance use disorder, really just to cope with those negative feelings, to not feel quite so bad. And unfortunately, I think what we are going to see in the long term is that the last couple of years have had a significant impact on substance use disorders that we have yet to sort of uncover or quantify. Especially as folks, we saw in social media, we saw, lots of norm setting last year related to increased drinking and alcohol use, because folks were at home. So we may not see the result of that for many years to come.
Yeah, I think back to some of the memes you may have seen when just scrolling through, people trying to adapt to their new normal at that time. And therefore making social media an unintended place where we are normalizing the misuse or the overuse of these drugs. When talking about the pandemic and how it's impacted so many aspects of our lives and exacerbated this problem that you guys were already working to fight, Caitlin, I want to come back to you because earlier this year, I saw a headline that made me think, wow, what is the landscape or how is this pandemic playing out in the Low Country area? But you guys made what some people call a progressive move or a progressive request, and you purchased test strips for an illicit drug. Educate us on that. Why was that progressive and how is it helping folks struggling in the Low Country?
Absolutely. So it falls into an evidence-based practice called harm reduction. And basically that is where we provide education and safe practices to people as they work towards eliminating their substance use. From a treatment provider, I need my patient to be alive to provide them treatment. And with the risk of and how deadly fentanyl is, we wanted to educate substance users as we're trying to get them into treatment and provide them support. And so fentanyl test strips are just that. They're test strips that folks can use to test any substance they're using for the presence of fentanyl. Research shows that when folks know what they're using, say it detects they're using cocaine and it detects fentanyl, it allows the user then to make a decision and maybe deter their use and say, this is not safe, I could potentially overdose. And so what we wanted to do, we saw such an increase of fentanyl overdoses in the Low Country, we needed another tool in our toolkit. And that's where the fentanyl test strips came from, and getting support from our state office to be able to get those. And so we provide them to everyone and anyone that would like them. We give them to patients, family members. And it's important to know it's not just for folks that use opioids. We are seeing fentanyl in all substances, THC, cocaine, methamphetamine. So anybody that's using substances or anybody that's experimenting college kids on the weekend. It's important that we give them this tool to educate and potentially make a life-saving decision not to use that substance.
Are you seeing patterns or behaviors changing?
Absolutely. I will tell you, working with folks struggling with, opiate use disorder, the majority of my patients are not actively seeking fentanyl. They are scared. They have lost. I had one patient report she had lost 10 friends in the last 12 months. She is scared for her life, and so the majority of our patients are not actively seeking it because of how high the overdose rate is.
When I hear that, it kind of reminds me of the phrase kind of meet people where they are. Some people may want to say, well, just don't do drugs. But the reality is that there are people doing drugs. So you're giving them this tool that will help educate them. So it's another, just like you said, it's a new tool. What are some other progressive ways or forms of education and communication that we are reaching out to people here in South Carolina?
Well, I think just conversations. We were speaking in the green room earlier, and we are, as the coroner's office, we're just encouraging people with at-risk family members, maybe people who have a history of substance abuse, to have a conversation. Do you know that this is a drug that is killing people? You have to think that fentanyl is not, it's an illicitly manufactured drug on the market right now, and it usually comes in the form of this pill with a stamp on it, M360 or M60 pills. That's what we're seeing here in Richland County. And so if maybe we can just have the conversation with our at-risk community members and say, hey, we know that you're out there. We want you to be safe. Fentanyl is bad and you don't want to take it. And so maybe if we could get some test strips here in Columbia, maybe we would have a lot fewer deaths. But conversations are important because we already know that we have community members who are actively using. Start the conversation. It's a tough conversation to have, but you know that they're at risk, so try to inform them. They may not see programs like Palmetto Perspective. So if we can just start the conversation at home first, and then maybe it goes out to the community in a different way.
Yeah, I want to add to that because you're right on point. I think intervention is the key right now. Every opportunity that anybody has to have an intervention, to have a conversation, to do the outreach, I think now is the time to do it with the way that we're seeing things change. And that includes healthcare providers. I think that we often expect that we'll be having critical conversations with our primary care providers or in hospitals. I think that's also where it starts. It's any point of access with any public system, with any healthcare provider. These conversations need to occur. We need to screen, and we need to be ready to intervene and connect that person to treatment if they're ready.
I see this as a step towards changing the narrative and getting rid of the stigma that historically has been attached to drug use, either prescription or illicit. How important are those steps? Are you seeing changes and changing the way people talk about drug abuse and talk about interventions and talk about someone just confessing that, hey, I need help with this?
We're seeing some change, but we could use a lot more change. And I did want to mention our Embrace Recovery SC campaign, and that's embracerecoverysc.com. We have their language, which I think is really important. I think us in the field have recognized for a long time that the language that we use when we talk about addiction is really important, because it can even drive shame, or it can make someone feel comfortable enough to say, I need help. And so the way we talk about people with addiction everywhere is critical, and that language is there on that website. Shame can be the real thing that keeps somebody from asking for help, and I think it takes all of us to make that change on stigma.
And to piggyback off that, we use the phrase secrets keep people sick. And so if we don't have this conversation, we know millions of Americans are impacted by substance use disorders. We know that almost everyone may know somebody in some way, shape, or form, but yet we use it like it's a dirty word. How often we will sit at a dinner table and say, hey, how's Uncle Charlie's diabetes? Is he managing it well? We don't ask that. Hey, how's Tony's doing with his drinking? Or how is he doing with the opiate use? We don't, and those are conversations we need to start having. We need to treat this like all other chronic illnesses, and talking about it, making sure people feel safe to talk about their issues or their substance use, so that we can direct them to providers that could provide treatment and potentially save their life.
Naida, how does the coroner's office play a role in educating people about opioid misuse and abuse and deaths?
So one, we want to share the numbers, and it's not public knowledge for us to share someone's death certificate, right? But we can share the number of deaths that we have related to this epidemic, because it truly is an epidemic. I am not joking when I say I talk to families every single day, and it's fentanyl that seems to be the problem, as Caitlin and Director Goldsby have stated multiple times. This is not just one group of people, it affects our entire community. So ways in which the coroner's office is trying to help with this is, one, to share the numbers, two, to say the names of the drugs so that people understand what they are. When we say opiates or opioids, I may not know what that means. I may not have ever heard that word, but I've heard Percocet, I've heard Dilaudid, I've heard Oxycontin, because maybe I got this when I broke my arm, or I hurt myself, or I had a surgery. So helping them to understand that there are programs where they can turn those drugs in so that they're not just out in the community. When we go into homes and there has been a death, even if it's not related to opioid use, we take those medications from the home and we turn them into the DEA. So we have a DEA turnover program at the coroner's office. The last thing that we do is we talk to families who may have other family members at risk. And we say, hey, listen, there's a drug on the streets right now, and it's called fentanyl, and it's really bad. And it causes you to go to sleep in a way that is not normal. So if you have a member in your family or someone that you're taking care of who may be prescribed opioids, or who you may suspect has taken something, maybe a little bit more than what they normally would take, go and check on them. I can't tell you the number of times I've gone out to a scene and a mother or a father has said they were sleeping so hard, I couldn't arouse them. That's a red flag. Call 911. If someone is that asleep that you can't arouse them, we teach a sterno rub, where you take your fist and ball it up in the knuckles of your hand and you rub it on the sternum right here in the middle of the chest. Believe me, it hurts. Just doing it lightly to yourself hurts. So if you do that to someone to try to arouse them and they don't wake up, you need to call 911, so maybe we can prevent these deaths.
That's shocking. The numbers are startling. You mentioned at least 3 times, and we talked before, almost every day you're making that phone call. Let's talk a little bit about the programs that are currently available here in South Carolina. For someone watching from the Low Country to the Upstate, what are some programs that you know of and that you guys help facilitate that will help South Carolinians dealing with these problems?
So first, we have a county alcohol and drug abuse authority in every county in the state. They are the publicly funded organizations that offer prevention, treatment, and recovery services. We also have 23 opioid treatment programs, or what are also known as methadone clinics, across the state. They really deliver a gold standard of care for anyone with a severe opioid use disorder. We have many recovery community organizations that are supportive not only of those trying to seek recovery themselves, but of family members, and offer a wide array of programs, including group therapy and group conversations and one-on-one peer support services. All of those can be found at our embracerecoverysc.com website. So there is literally a door to walk through in every county of the state.
Okay. All right. Oh, Desiree, we have another comment on social media.
We sure do. Are there any over-the-counter medications dangerous? Are any over-the-counter medications dangerous when mixed with prescribed opioids?
Well, I'll tell you, Benadryl is definitely one of them. It causes you to be very sleepy. It causes a very drowsy effect in most people that take it. And so if someone is on opioids, prescribed or illicit, Benadryl is very bad. It's going to make you go to sleep in a way where your respirations are going to become slower and slower and slower, which can lead to cardiopulmonary arrest. So you want to be careful in taking any medications together. This is just good general knowledge. Any medications that make you drowsy, you should definitely try to avoid taking those together. And this is where your healthcare provider becomes really important. Call and ask a question. Most doctors' offices have a nurse line where you can call and ask, is it okay if I mix these things? Even a simple Google search will help you understand that some medications should not be mixed. But calling your healthcare provider, if possible, can help. And if you don't have a healthcare provider, the almighty Google can sometimes provide you some safety measures that can help save a life.
And although it's not a medication, the other thing you really should not use with opioids is alcohol. Alcohol and opioids can do very much the same thing. They can make you very sedated and slow you down to the point where you're dead. So using alcohol with opioids is very dangerous.
All right, Desiree.
Our next question from the viewers. Are opioids prescribed at different rates amongst various racial, ethnic, and socioeconomic groups?
So this would go, to the prescription drug monitoring program data that we monitor, and a very important program. Unfortunately, we have to say, since we've been monitoring the opioid crisis in South Carolina, really from 2014, we've been great about not having the pill mills that other states have seen through that drug control program. So we were fortunate in that we didn't have the problems that Kentucky, Florida, West Virginia had. That being said, the overprescribing that we were seeing in the mid 2000s, it really was toward the white population. And so in turn, we saw less impact among our minority populations in the South at that time and in those demographics.
And to give you some data, 55% of the overdoses that we see on opioids are in white males, 31% are in white females. So it is mostly male, mostly Caucasian. Certainly anyone can, so there's no one who is exempt. But that is the population we're mostly seeing this in.
Since we started tracking and taking steps to fight this, what changes have been put in place to help when it comes to prescribing these medications? Have there been changes, and what are they?
Oh, I think the prescription monitoring program that Sara mentioned is a big piece of that. Today now, if you're going to get a prescription for opioids in South Carolina, the doctor should look you up in the system first, make sure you haven't had other prescriptions lately. You're not going around doing doctor shopping, trying to get prescriptions from multiple places. And put your prescription in that system so another doctor down the road can see that yes, this is what you've received. So I think the prescription monitoring program has really helped with the overprescribing. We've seen a decrease in prescribed fentanyl of 46% in the last 5 years, and I think that's due in large part to the prescription monitoring program and education. So I think that's been one big piece. And I think the education, educating doctors that, if a patient does have a lot of pain, let's look at alternate ways to treat that. And sometimes you do need to use opiates, but then let's prescribe them for 3 days, not 7 days, not just give everyone a 30-day supply like we commonly saw 10 years ago.
What are you mentioned earlier about the reversal drugs that's available. What does that look like here in South Carolina?
So naloxone is a drug that you can give someone that pretty much reverses the effects of an opioid overdose. So the respiratory depression, the low blood pressure, you can stop that very quickly. And it is very much life-saving in those cases. So pretty much all of our EMTs now have it. As I said, we've trained over 11,000 law enforcement officers and other first responders to have it, and they actually carry it with them when they're on duty. But in many of our communities, you can actually go and just as a public citizen, go to do a 10 or 15-minute training, get the naloxone, and then if you come upon someone who is in an opiate overdose situation, you give it to them. And again, it can be very much life-saving, but the key is you have to do it very quickly, which is why having people have it is so important. I live in, my home is in Beaufort, and they did a program down there, and I went there, and they didn't even make us get out of the car. They gave us a 5-minute training, they handed us the medication, and now we have it, so if we would ever need it, if we'd come on someone, we could immediately help them out.
How do you work with hospitals to educate people and to help people?
So we have a number of hospitals across the state that are implementing the SBIRT program, that's screening, brief intervention, and referral to treatment. A number of hospitals doing this in the emergency departments to anybody who comes in for any reason, screening that individual. If they find in that screening the individual may have an alcohol or drug problem, they're doing a brief intervention and they're referring that person to treatment. I think we're seeing more and more interest in hospitals taking up the practice of inpatient addiction services, which we think is very important because you've got somebody on an inpatient unit for some amount of time. Maybe perhaps that patient is being treated for a physical symptom related to a substance use disorder like endocarditis or another infection. That's really the best time while they're in that hospital bed to have a really strong intervention, perhaps with an addiction team. and get them stable on a medication, perhaps if needed, to refer them to outpatient specialty addiction services when they're discharged. I think we're seeing more of that and would like to see more of that across the state. Hospitals play a critical role in this.
We talked about how COVID has impacted our lives, and we see that we've had programs and funds come down to help people survive the pandemic. And we also know that the pandemic, maybe anecdotally, has impacted these numbers that we are seeing, or caused these numbers to go up that we're seeing. Do you see more programs or more funds or more resources coming down the pipeline? Because we know that during this time in our history, people are turning to these drugs more often.
So we've seen a couple of federal packages, CARA 3.0 and of course the American Rescue Plan Act that were passed and gave our federal partners, the Substance Abuse and Mental Health Services Administration, more funding to support states with their mental health and addiction services. I think the first that we saw of that was in April of 2020 when the Department of Mental Health and DAODAS worked together to get a federal grant to stand up the support line that Dr. Simmer mentioned, the SC Hope support line. That federal money gave us the ability to, within just a month or two, really turn on a 24/7 support line that even today we're still seeing utilized with an average of 15 calls per day. Folks in the state knowing that they've got a connection to mental health professionals because of any mental health or substance issue that's been exacerbated by the pandemic.
We've been working or targeting or fighting this issue with laser focus for some years now. Where do you see successes, and where is more work needed? Let's start with Kate on this end this time.
I would say the successes that are seen are the partnerships that have been formed. Unlikely partnerships, I'll say. When I first started over 10 years ago, I never thought I would sit in the same room with a law enforcement officer having just brought a patient that they saw in the community that wanted help. They're on the other side of it. I'm treatment and they're law enforcement. Hospital systems, like Director Goldsby, say, changing their practices and reaching out to us and say, hey, if I can stabilize this patient inpatient, could I do a warm handoff to you, where we didn't necessarily see that communication before. School systems reaching out and saying, this is a problem. So the partnerships that have come, unlikely, like I said, folks, peer support specialists, people in recovery that are joining the fight that are so valuable that it's just truly been incredible to see that every discipline, I would say, in the community has stepped up to say, how can we participate in this fight with our expertise? And that's how I truly believe we'll have to continue this. Treatment, if we could have got our way out of this, we would have done this a long time ago. So it takes all of us. And so I've been very pleased to see those partnerships.
Where do you see successes, and where is more work needed?
Well, I just came into office in January of this year.
Congratulations.
Thank you. But the coroner's office wants to be involved. We're the ones that have to deliver this tragic news to families and to the community, and we don't want to have to continue to do this. We want to be able to partner with organizations like what Caitlin is doing and what Dr. Skimmer and what Director Goldsby is doing, to be able to say, hey, there are programs out there that can help you, and maybe we can refer them. Maybe we can use our social media platform and our office to push some of these programs, because I'll tell you, we work with the homeless population, we work with so many different groups who say, well, we didn't know that there was an option for help. And so maybe just being able to be a conduit between all of these different agencies and these programs as the coroner's office, because we want to see you and not have to view you. And so maybe we can help in that way. So that's our goal at the coroner's office, is to be that conduit.
Dr. Simmer, from the perch of DHEC, where do you see successes, and where is more work needed?
Well, I think we see successes, as I said, in the prescribing. I think we're seeing much more responsible prescribing of these medications than we used to. That's taken, a lot of the medicine out of the system. I think we're also seeing progress in stigma. There is still a lot more to do with stigma, but I think there is a better understanding today that this is an illness, that treatment is effective, and we have more effective treatments too, which I think is the third component. We have things like buprenorphine, like naloxone, things that we really didn't have 10 years ago, or at least not to the degree we use them today. So I think those are all big areas of success. and we should celebrate those. I think we still need to really focus on the flow of illegal opioids into the state. There's a lot more to be done to cut that flow off, and I think that's a big problem for us. Stigma is still certainly an issue. And I think the third thing that we need to focus on is making treatment available to everyone. Right now, if you don't have the ability to pay for treatment, it can be very difficult to find treatment, especially inpatient treatment. So I think that's another big area we need to focus on.
Sara.
Yeah, all great answers. I would say, I've been with DAODAS since 2016, and in that time we went from having 3 county authorities that had medication-assisted treatment to treat opioid use disorder to now all of them having medication-assisted treatment, which is the gold standard of care, either an agonist or partial agonist medication or full agonist for that brain disease. We have a long way to go, I think, with folks understanding that medication is the expectation and the standard of care for opioid use disorder, and that's a hard thing to understand. But it's something that other states are ahead on, have been ahead on since the 1970s. So more access, as Dr. Zimmer said, to medication-assisted treatment, and I think we have a lot of opportunity in our criminal justice system. With drug courts around the state that have yet to be developed to the National Association of Drug Court Professional Standards, and then access in our jails. And that's going to be a hard nut to crack as we look at resources and really putting treatment inside of the criminal justice system.
We have a question for Facebook, but before we get to that, what is a good place to be at? I don't know if I think that's a hard question, but numbers are increasing. We've seen some successes and we've seen some progress. When do we reach success? Do we reach success? Where do we want to be?
I think we reach success when we see opioid dependence the same way we see diabetes or high blood pressure, when treatment is as easy to access as it is for diabetes and high blood pressure, and when every person in the state is carrying naloxone with them, so if they do come upon someone who's overdosing, they can treat them right away. At that point, I think we're in a good place.
All right. Desiree, we have a comment from social media.
Yes, and on topic of where we can make progress within the state, the question is there anything that can be done from a legislative standpoint to address this crisis?
Gosh, I can say from the coroner's office, there's been legislation introduced by the South Carolina Coroners Association to try to even provide coroner's offices with naloxone, so that, because sometimes we go out and it's actually not a death, they are just that sedated, and so to be able to provide that for them would be helpful, but certainly it's not the answer to everything, but it's certainly something that could be helpful. And especially in the rural communities where they may not have such high access to care, to be able to have the naloxone at that office that is open 24/7 could be very helpful. So I know it's not the number one answer for everyone, but it can certainly assist in the epidemic.
And I think one thing I would add is, I would say the legislature has actually done a lot in South Carolina. They've made a lot of positive changes. But I think more, like Sara said, for drug courts. I think the legislature could give us more authority for drug courts, require more drug courts, and I think that would be a big help going forward.
I wanted to circle back to what you said about every person carrying the overdose reversal drugs.
Right.
Do we have data or information on programs that offer that now, or how much training is happening in the state to get these drugs in hands of community members?
Sure. So I think we've got, over 60, maybe between 60 and 100 community distributors of naloxone statewide right now. You can see each location on the justplainkillers.com website. In addition to our law enforcement and firefighters being equipped and administering, which we're tallying every day, we are aware of how much distribution is being done to individuals who, as you described in Beaufort, needed a quick drive-by to pick up a case of naloxone. We know that the medication, which is a prescription medication, is available at all of our retail pharmacies in the state, but some folks may not have access to a retail pharmacy or the pharmacy benefit that affords them that medication. And so these community distributors, they're really like the Charleston Center, our recovery community organization. They're the organizations that are in the closest proximity to the people who are at highest risk. And so the state is, with federal funding, paying for a lot of that naloxone, and we're keeping track of where it goes.
Is there a role? Oh, sorry, go ahead.
It just goes back to your statement before, meeting people where they're at. The goal is to make sure that naloxone is in households across the state and across the country. When I do trainings, we really talk about it, normalizing it the way we do with an EpiPen. You know, you use an EpiPen for an allergic reaction. It's a rescue medication to get further treatment at a hospital. We really want naloxone to kind of fall under that as well, and normalize it along the way we're trying to do with the chronic disease of addiction. But meeting people where they're at, there have been people that have reached out, and because of the shame of having a family member or themselves with an addiction, they are afraid to walk into the doors of the Charleston Center or come to a training. I've met people in the community and say, where would be a safe place? We've met, you know, our community partners, peer support, have gone to a McDonald's, done a quick training and handed out, because we will come to you. If you can't come to us, the most important thing is we want to get naloxone, Narcan into hands of as many people as we can, any which way we can.
Is there a role for the faith-based community?
Absolutely.
Oh, absolutely.
Yes, absolutely. You know, we've done a lot with the faith-based community for COVID, but they are very much interested in helping in other ways too. And I think there's an incredible role for the faith-based community, both in combating opioid abuse, but also providing education and helping folks find treatment.
I can just imagine, you know, our statewide viewers when they're hearing this information, and some of them I can see it pulling at their heartstrings, and I want to help. What can I do? And they may just be regular citizens. How can regular citizens? What role do we play in this fight?
I can think of a few things. First, you know, going back to what Coroner Rutherford was saying, is the amount of unused prescription drugs that we collect yearly is just amazing. So knowing where your local take-back programs are, and that's also on the justplainkillers.com website. Last year, we collected over 25,000 pounds of unused prescription drugs across the state through those take-back programs. Wow. So cleaning out your medicine cabinet or your kitchen cabinet and getting those unused drugs, not saving them for a rainy day, but getting them to a safe disposal site is probably number one. And I think that really curbs, you know, the initial use of some of our adolescents who want to experiment, thinking that is a safe substance, making sure that's out of the home. But if you need it and you're using it, lock it up so that your neighbors, your kids, you know, other family members can't access that. But you can access it when you need it, and you're keeping track of it. I think that's really number one.
Where does South Carolina fare, or where does South Carolina fall with other states in the country dealing with this problem?
Well, we're above the national average, I'll tell you that. I'm sure Caitlin can give you the exact numbers, but we are above the national average. I think we're at 45%.
Yeah, in overdose deaths last year alone, the national average was 30% increase. Each state saw, or the average was a 30%, and South Carolina was 43%. So as far as overdoses, we are above the national average. And I would say, if you look at surrounding states or others, we are experiencing the epidemic in similar ways, with certain hotspots or rural communities hitting, but not even just opiates. We're seeing a rise of other substance use, cocaine, methamphetamines, alcohol. So we are just as much impacted in South Carolina as the rest of the country.
Do you work with other states or collaborate with other states to flesh ideas out or to come up with what we can do next?
Oh, often. Yeah, so DAODAS is part of the National Association of State Alcohol and Drug Abuse Directors, and we're talking to each other weekly and monthly, and with the feds and with other partners, to really make sure we're implementing the best strategies and learning from each other, because some states really get ahead of things, and we can all learn from those best practices. So I think that's common even too with our public health departments communicating.
Yeah.
What's next on the horizon? We've had, it sounds like, you know, we have the information, we have the data, we have the research, we have the collaboration with so many state agencies and organizations. What are your next steps? And where do you need the most help from the public?
Can I speak to the coroner's office, because I think we're kind of new to the table in terms of this. I think it's about having open conversations. There are programs that allow you to do, drug overdose fatality reviews, looking to see where are your hot spots in your areas. Can you do focused outreach in those areas? Are you using your faith-based community leaders to help drive the message that fentanyl is bad, here is how we're going to combat it? Do we have a way for the coroner's office to be able to provide Narcan or naloxone trainings? Can this be a spot where people can come and receive training? And so putting the coroner's office out there in a different way, but speaking to all of the offices, because, Richland County, we're centrally located, but there are very rural parts to Richland County. It may take a long time. It may take 30 minutes or so for that ambulance to get to the hospital before they can even get Narcan. So think about your areas like Beaufort or Lancaster, where it may be more rural and they need that access. So I think that from a coroner's office perspective, we need to be out in the community, talking to the community about the trends that we're seeing in deaths, whether it be fentanyl or other chronic illnesses, so that they can educate the community and use the community leaders to really push those messages out.
What's the response been so far? I'm curious, because you're absolutely right. That's a different role than what we're used to for the coroner's office. What's the response been like?
Some people say you need to stay in your lane. You're just supposed to deal with the deceased. And I say, well, I think the community would want to know why people are dying in our community. I think they want to know that fentanyl is a problem, that opioids are a problem, that drugs are a problem, because this is not a new thing. But there has been a spike, just as Caitlin was saying, a 43% increase. That's crazy over the last 3 years. So what we want to do is educate our community and say, hey, the coroner's office is standing shoulder to shoulder with you to combat the drug issues in our neighborhood. So for us, we're seeing a very positive feedback, but we do have some naysayers who say, just stick to dealing with, decedents and their families. But that's one of the ways that we will deal with them, is by educating them.
Caitlin, in the Low Country area, what are you hearing from the community? What are they saying that they need more of, and how are they offering to help?
You were talking about what can be done, and what I hear from the community members is that call to action. I'm seeing that people are saying, what can I do? And there is no task too small to help with this fight. So if it is having a conversation with your child at the dinner table, knowing stuff's going on in school, being a little bit more curious, all the way to attending a Narcan training, all the way to changing your language, not using the word addict. We don't use that. It's someone with a substance use disorder. All of those things can be really beneficial. Being an advocate for your health care. Should you go and have a procedure done and the doctor wants to prescribe you any medication, asking. I know before all of this, I never questioned my doctor when he gave me a prescription. And now, can you tell me a little bit more about this? Is there any risk to taking this medication? So those are all things and steps people can empower themselves in this fight.
You hear a lot of that, talking more with your doctor, because there's a lot of information. There are some alternatives out there. I wanted to come back to you, Sara, because I wanted you to share the resources in your websites. There are a few of them that come to mind, and it's just a hot spot. It's a plethora of information for people. For folks watching and listening, where can they go to get more information, to learn the questions to ask, and just to know what's out there for them?
So the first place that I would recommend is justplainkillers.com. And that website has a lot of information related to opioids. What are opioids, and how can we store them safely? What are the signs of overdose? How can we prevent overdose? Where can we access Narcan? And then the data. I know we've shared a lot of data, and there's a lot of data on that website to look at county by county, how each county is faring in relation to the state and others. So really that is the best place. And as Caitlin said, some information on how to have a different conversation with your healthcare provider and the person that's going to prescribe you medications. Second, I would say the embracerecoverysc.com website, which really is special to us because it's a reminder to everyone that we have nearly 400,000 South Carolinians living a life in full recovery, right? They are living a self-directed and fulfilling life, having successfully managed their chronic illness. that's worth celebrating.
It is.
And so can we look at the language on that website and reframe how we think about addiction and really recognize those and celebrate our South Carolinians in recovery? A lot of information there, including where to access treatment services, recovery services, and Narcan. And then I would say just another resource that was mentioned earlier, Dr. Simmer mentioned the SC Hope support line, and that's 1-844-SC-HOPES. And again, that's the 24/7 support line that we have with the Department of Mental Health, where any caller can connect with a licensed addictions counselor, a peer support specialist, or a mental health provider to really have a conversation about what they're experiencing with substance use and mental health issues.
I started the program off by asking a very simple or very basic question, or at its core, very elemental. What are we talking about? What drugs are we talking about when we say opioid? So, Naida, I wanted you to read off that list again, because sometimes we just don't know, or we hear a word, but we're not connecting with it. But you gave us a wonderful list, or a good list, basically a list of information. But I wanted you to read that off again so people can know what we're dealing with.
So we have oxycodone, Oxycontin, Percocet, hydrocodone, Vicodin, Norco, Lortab, morphine, hydromorphone, also known as Dilaudid, fentanyl, codeine. And this is a pretty good list, and these are the things that are most commonly prescribed. And so I guarantee you that your viewers and the people watching this program later on, they have been prescribed these at some point if they've ever had a pain issue. And so we are encouraging them, find your local take back program so that we can get these drugs off the streets.
And above that, Sara, I wanted you to give us that number one more time of the number of South Carolinians living in recovery.
So we estimate 378,000, but it's more and more every day as we successfully, get folks stable and living a life of recovery. So it's just a really beautiful thing to see on our SC Hopes, our Embrace Recovery SC website.
Embrace Recovery SC, justplainkillers.com. There was one more website that you gave, a great resource, 1841.
It's 1844.
There we go.
SC Hopes, HOPES.
Okay, and so we have those links, those websites on the screen, because it's really great information. That was a huge number that you gave. Living in recovery is possible, and we want everyone here that's struggling to be able to do that. Thank you all so very much for joining us. We appreciate your expertise. Thank you to our online viewers for your questions and your comments, and to all of our listeners and viewers across the state. Thank you for joining us tonight. For everyone here at South Carolina ETV and Public Radio, I'm Felicia Evening. Good night.